One of the big things that I always had was that I bit my cheek an awful lot, which led to a lot of mouth ulcers.
My front teeth were quite askew and they went off in different directions.
My lower jaw was too far back.
Probably found that I didn't smile a lot as well, didn't show my teeth.
It was like kind of affecting my life, you know, self-conscious and stuff, so.
I just didn't really smile with my teeth, I guess. I wanted straight teeth, like anyway, from like a young age.
Orthodontic treatment has a huge benefit for patients. It changes their outlook in life, it changes the way they are received by their peers, it makes them more confident, it boosts their self-esteem. Parents generally are very pleased with the change they see in their children. And adults too, it's something they've wanted to do all their life. And when you give them that gift of straight teeth, sometimes it can be quite overwhelming. They're emotionally quite moved by it.
It was a bit of a shock at first. Obviously it's like you've got things in your mouth and you've got to get used to them, but once you get used to them it's just like they're just normal.
So the different kinds of braces that we use at Glasgow Orthodontics are metal, or there are ceramic, which are white. The metal ones are usually used by the NHS patients, and the white ones are usually used by private patients. Both braces more or less work the same, but the question is more of an aesthetic one.
Treatment could be carried out with our nurses and the therapists, but the treatment plan's all organised by our specialist orthodontists in the clinic, so they oversee everything that's going on in the clinic, ensuring that at all times their treatment's on track and that it's the best standard possible.
I liked it, it's very calm, it's a nice calm atmosphere, you know.
Everyone was really friendly. I always felt like it was easy to ask questions.
Knowing why they were doing something made you more confident in actually doing it.
There are risks involved with braces. They are small, but patients should be aware of them. If you've any doubts, please would you ask your orthodontist to discuss the risks with you.
One of the things about orthodontic treatment that perhaps a lot of patients and mums and dads don't realise is that once you've straightened the teeth are actually very likely to go back to the position they were in before treatment started. That is why after treatment we fit retainers on the teeth. So we sometimes see patients, 5 years on, 10 years on.
I mean, I can open my mouth and my teeth don't look squint anymore. I can eat quite comfortably and not going to bite my cheek.
I feel a lot better, I'm a lot less self-conscious, I smile a lot more now, and I'm quite confident in my face a bit more.
I definitely recommend it because it's worth it.
Definitely worth it. I mean, it definitely boosts your confidence. You feel a lot better about yourself.
I definitely recommend them. The treatment that I've received has just been excellent.